Hello, I'm Dr. Tim Mahoney, Mayor of Fargo. I understand that these are trying times that can create stress, anxiety, and may feel overwhelming. From newfound economic hardships to the pain of losing a loved one, each of our lives has been touched in one way or another by COVID-19. As a resident of Fargo, a father, and your mayor, I feel for all of you. It is important to remember that everybody reacts to stress differently. We need to encourage every person to find healthy methods to cope. Pause, take a breath. Take breaks from COVID-19 news from time to time. Make time to rest, recharge, and stay active. Reach out to your friends, families, and loved ones, and let them know that they are valued. And of course, seek help if you are overwhelmed. No one needs to be alone right now. There are resources available throughout the Fargo community to get people the assistance they need. Please do not hesitate to dial 211 if you believe you or someone else needs help. There are mental health resources set up to assist people, not only in these unprecedented times, but beyond it as well. And I would like to take a moment to recognize and acknowledge the 20% of Americans facing mental health issues. Too often, people are afraid of the stigma associated with mental health conditions. There is no shame in needing help. In fact, I believe seeking support when you need it is a sign of strength. You would never ignore a broken bone, a serious cut, or burn on your skin. Just the same, we must seek treatment for the invisible illnesses of the mind. Now is the time to get the help you need and embrace a healthier, happier lifestyle. Thank you.
Here at Prairie St. John's, we're offering hope and healing to individuals facing behavioral health and substance use challenges. We are taking proactive steps to keep our patients and team members safe while serving the needs of this community. As leaders in mental health care, we are making every effort to avoid unnecessary panic or anxiety among our clients and families during this dynamic situation. We are closely monitoring information provided by key government, regulatory, and local entities and following all recommendations provided to us. Our facility is fully operational and serving the needs of our community. We are taking proactive steps each day, such as enhanced cleaning, requiring face masks for patients and employees, and screening each person who enters our buildings. We are serving individuals at all levels of care, from day treatment to inpatient. We are utilizing technology when necessary. However, it is very important to us that we preserve the high-quality, face-to-face treatment that we have been offering for the past 20+ years. We know the human connection between each client and their doctors, therapists, nurses, peers, and families is a huge component in the path to healing. Much like other behavioral health facilities, we are seeing a drop in the number of individuals seeking help at this time. We know there are people out there suffering silently in their homes, concerned about entering treatment facilities due to COVID-19 fears. Behavioral health really is so similar to your physical health in that early intervention is crucial in reversing the negative trajectory someone is on. A new term you will start hearing more of is what researchers refer to as diseases of despair, which include drug overdoses, suicide, and alcohol liver disease. This happens when there's a sense of despair related to long-term social or economic outlook. This pandemic is wreaking havoc on normal social interactions, financial security, and emotional stability for so many. It is projected that 75,000 Americans could die from diseases of despair due to this crisis. Our biggest fear would be knowing people are struggling so greatly when we have caring staff and evidence-based programs ready to provide the necessary services for these individuals. We want to play an active role in connecting individuals with appropriate treatment and aftercare plans so we can reduce the negative effects of this crisis in the months to come. I am pleased to say that 90% of our patients report feeling significantly better at discharge than when they were admitted. We have helped thousands. We will work with you to get your life back on track and develop skills that will keep you on track in your recovery. I'm proud of the individuals who come to Prairie St. John's seeking help. I encourage each of you to take a moment to reach out to someone you know who may be struggling and offer to help find a better tomorrow. I'm proud of the staff that I work with, and I know so much suffering can be greatly reduced for those in this community. There is hope, there is healing. Together, we can do it.